So we've begun. It's okay. Don't feel compelled. All right. Let's see. Noteworthy. I'm looking at the exam. The exam's got 70 questions on the final, and there's a fair amount of review questions on male and female anatomy. I didn't get a chance to do the review recordings. I had to start with micro first. I'll get to yours because they're they're young, they're impatient. But I'll get there. And my wife has one of the worst cases of poison ivy I have ever seen. We got one done with the presentations, and the presentations were excellent. So I was very happy with that. And immediately, I just said, "We're going to urgent care now." It was all red, inflamed, angry, yuck, all over multiple areas. So not pleasant. So that preoccupied me and occupied our time, which means I actually have to work and help take care of her. So I signed for her to take care of me, but she tells me that was not contractual. Thank you. One smile, fast asleep. I know. Heaven knows what you're looking at online. And this side, usually it's a good side, just having an off day. It's okay. I can take the hit. All right. So what the point I'm trying to make is, for both the male and the female, do a review of the anatomy. As I do the dictation, you're going to, as I begin to, some of the stuff is just boilerplate. I'm not going to ask you about the suspensory ligament or the ovarian ligament or any of that stuff as we go through. But as time goes on, but we are going to revisit the blood supply with regard to remember the uterine anatomy. We're talking about the stratum basalis and the stratum functionalis. That's important. Anatomy of the breast, the reason why it has that axillary tail, it goes to the armpit, why that's significant. All of those are things that are certainly important. So, at least do a cursory review over this and listen to what I have to say when I get that out. With any good luck, I doubt it will be this evening. With any good luck, maybe tomorrow morning I can get cracking on that. And so all of those kinds of things I think are worthwhile looking at with some degree of detail. Well, certainly we're going to talk later about pelvic inflammatory disease and more about ectopic pregnancies. I don't know so much about antevertebrate or this kind of anatomy. I don't think it would be on there. We're going to spend a fair amount of time talking about HPV and cervical cancer. That's part of it, because we do sexually transmitted diseases, some degree of presentation, a few questions on that as part of this particular unit. So I just wanted, as I was buzzing through it, I just wanted to get it's more about the endometrium than the other structures. And again, the distinction, the functionalis, the basalis, the role of the spiral arteries, the spasm, the whole deal, because we're reviewing the ovarian cycle and the menstrual cycle, and we're going to tie the two cycles together to understand what basically leads to what, and why you get a whole lot of information from it. See, also sort of like the heart, one real slide kind of compares everything that's there. All rather straightforward, blah, blah, blah. Not so much in the external anatomy there. I don't think I'm doing any homologous or analogous structures, which I had done previously, I'm sure you recall. I just wanted to buzz through that. I don't recall if there's a breast cancer question or not. Maybe there is, but I don't want to surprise you. If you put up with me enough, Lord knows. There'll be no significant awards for that whatsoever. And here we go. So I may have had a bit of this before, but that's the distinction. Like I said, the frame is male is fairly straightforward. Start making sperm at puberty, and you continue more or less through a lifetime. The quality of exactly the process doesn't change. Maybe the amount of sperm, maybe the quality is probably a poor term, but maybe just how the genetic degree of stability of the sperm might be something that changes over time. This is a little bit different. There's a limited window here. And the window, and if you look at the numbers, for, let's think it's about a 40-year period on average. So, and roughly, if you say 40 times 12, that's 480. And so this will tell you the same thing. Typically, less than 500 eggs are ovulated under normal circumstances for a typical female over. Am I saying that correctly? You look like a group. Yeah. You know, just for a typical female, I have to say woman, person, trying to be somewhat facetious, intentionally funny for a purpose. You know what I mean? Biological female, what drives me freaking nuts. Oh, I may get another one here. I got my first warning from, it wasn't a warning. I had I recorded, they said this one is for only 18 or over, so be careful. Not this one. I got one from my micro class. There may be somebody under 18. I could be in trouble. They said there was no impact on my YouTube making privileges. It's significant. Do you think it's funny? I know the picture that got me. They probably thought this was one of those, naughty movies. Let's say it engaged in a limited fashion of full frontal nudity. You would think people would enjoy themselves a little bit more. Going forward, I realize you're closer to the end of your collegiate career than the beginning of your collegiate career. Have fun in life. Ask questions. I know we haven't done a lot of that here. Try to. It's been an opportunity, and don't forgo it because you still have time. Pick the brains of the people who are here. I mean, there's a reason, not me, these other people are here because they're smart. I'm just getting a paycheck. I got to keep getting paid. I can't afford it. My best friend, I told to him last night, are you ready? I'm exhausted. I'm so busy being retired. I'm like, it's okay. I'm working. I'll be fine. I'm not that tired yet. So moving on. So oogenesis, the production of the female not game, gamete. We digress. And again, it's not unusual. If you want to think the stem cell itself, these precursor cells start with mitosis, and then once they divide and they produce what are called primary oocytes. These are all done during gestation, and they proceed. I'm sure you're aware of this. You must have covered this stuff in genetics, did you not? You don't count. Yeah, that's Yiddish for maybe a little bit. Okay. Primary oocytes undergo meiosis 1. So they're suspended in meiosis 1, which means, and basically where they suspend them, it's prophase 1. So they've already undergone the crossing over chiasmatic synapses, whatever you're gonna call about it. And then as they have effectively, the ones that become the primary follicle that are effectively ovulated out, typically alternating from one ovary to the other, from right to left, typically. One each, typically. Okay. Then undergo, and when they are ovulated out, they're in meiosis 2, where they remain. Okay. And it's typically, I think it's in metaphase. We'll see if they have any more specifics. And until fertilization really is when the completion of meiosis occurs. Okay, so that's interesting in and of itself. That's there. So the secondary oocytes undergo meiosis 2 to produce the ovum. So the differences between oogenesis and spermatogenesis, the oocytes occur only in the fetus. Primary oocytes arrested in late prophase 1, and they resume ostensibly at puberty. Secondary oocytes, meiosis is arrested in metaphase 2, that's what I thought, and it's only completed if fertilization occurs. So the presumption is, here is some interesting theory now that maybe you could stimulate those precursor cells to generate. And again, the frame I would present it to you in is the frame that my first wife and I, in vitro fertilization had just reached the map. We were doing all these inquiries as early as 1979. We were married in 78. We were starting about 79 when I started practice in June of that year. We wanted to start a family, and we realized that problems were going to occur. And so we saw a lot of people, and IVS was called the Jones Institute. Interesting, they were located in Virginia Beach. It's where their clinic was. That was the original research and the original people who were doing the first IVF. So, and I would listen closely because you've heard me enough over the last year. Why we're seeing more problems with fertility today, and thankfully there's a lot more options, and thankfully there's been advancements in IVF, and that's what sort of brought me onto this topic, because they're seeing that they may be able to stimulate natural egg production, and probably has come from the IVF, where you're trying to hyperstimulate and basically induce multiple eggs to basically be ovulated, or at least be retrievable from the ovaries directly. You're trying to get them to be at a stage where they would normally be ovulated, and maybe take them and artificially inseminate them. Voila. My son and daughter-in-law, remember, he's not biological, so it didn't have anything to do from when she came from. Both their kids, tomorrow he'll be 6, the bandit, is our IVF. My wife's now, her third of 4 biological sons. He and his wife have 2 daughters now, both by IVF. There's a message here. So, I mean, it's not necessarily an easy road comparatively for some. So I think that's important to kind of keep in the back of your mind, and an interesting frame. I don't know. I don't know how else to express it. So production when the fetus, the arrested in the appropriate areas, metaphase 1, okay, prophase 1, okay, secondary metaphase 2, birth, female presumed to have lifetime supply, primary oocytes. There's 2 parallel pathways going on. The egg basically being maturing and being selected as what's become the primary oocyte, and its enclosure that nourishes it and protects it, which is the follicle. Go to the end of the process. When the egg is ovulated out, what's left is effectively this enclosure we call the follicle. That becomes the corpus luteum. And that, because it has a yellowish color, that's where the luteum comes from. And that basically assumes the role in the event of fertilization and implantation until the placenta forms and is functional, or in the absence of those events, it deteriorates after about 10 days and stops producing principally progesterone and some estrogen, and that triggers, when that stops producing, the onset of menstruation, period. So that's really what happens. So here you can see the follicle developing from these pregranulosal cells. The oocyte is incorporated within it. They call it primordial. That happens. Primordial will give you the idea that it's pre-birth, and then that primordial follicle, at some juncture, once the onset of puberty and the start of menstruation happens, we have a primary follicle, which as it begins to develop becomes a secondary follicle. Within that, we have, again, the stem cell producing the oogonium, and the primary oocyte, which becomes incorporated in this. And again, it's arrested after meiosis has already begun. When it becomes selected as the primary oocyte, and the language is important because that can confuse you test taking. When it becomes incorporated as the primary oocyte, at that point, okay, it has already begun to undergo meiosis. Like I said, you're familiar with the events, and so it's prophase 1. And then subsequently, As it becomes the primary follicle, then it begins to undergo a series of changes. Okay, so the primary follicles have a single layer of what they call granulosa cells, secondary follicles, multiple layers. And what happens, without going in, there's a lot of steps that are in here that I don't want to go in here and have a contest to see who can memorize. Is basically understand when it becomes what's called a vesicular, and the term I constantly use is antral follicle. That's the one that is effectively going to ovulate, because that vesicle, remember, a vesicle is a fluid-filled container. In this case, the follicle is containing a fluid, and the fluid is to some extent nourishing and protecting what's going to be the egg that's going to be ovulated. But that's also, as it enlarges, and it's pretty good size, as you will see from the measurements that we will see, is going to exert the pressure on the ovary itself and basically cause it to rupture in that area limitedly and effectively spit out that egg into the abdominoperitoneal cavity, and hopefully, and for the vast majority of times, being swept into the oviducts on its way toward fertilization. Got it. You're all breathing with excitement. So, I mean, I'm surprised we don't have a stork here. Remember the stork? How did the baby get here? The stork? I mean, this woman she had like 12 kids. By kid number 8, her husband's down at the zoo throwing stones at the stork. She got pregnant again with number 13. The stork came to her house and started throwing stones at her. I had an NSFW, whatever that means, not safe for work joke that I will not tell. But it's hysterical. If you have HBO, I'll show you I'll show you the things to look for on the IMDb. It is hysterical. It's for the late Bob Einstein. No Curb Your Enthusiasm watchers here. Watch Curb, okay? Marty Funkhauser, the very tall guy, his name is Bob Einstein. His brother's name is Albert Brooks. It was Albert Einstein, so he changed it. It was just a little confusing. And a very funny, it's a biography of him because of all the work he's a very, very funny man. And the show missed him tremendously. There. If you get a chance and you can find clips, just watch Palestinian Chicken. Maybe the funniest episode ever. You saw that episode. Which again is NSFW. So moving on. So here you can see it. See, as it begins, once it's selected, we begin to see this fluid, the vesicular antral follicle, and that's going to exert enough pressure on the ovarian wall to push that out. And what's left of this follicle is going to become the corpus luteum. So you can see 2 parallel pathways. The follicle, it's developing, changing, containing the fluid, and then subsequently doing this. And on the meiotic side of things with the egg itself, once that's in the process of doing that, once that primary follicle is selected, it completes meiosis 1. And here you generate typically the first polar body. So think of it as an asymmetrical meiosis in the sense that one is going to the polar body is going to basically disintegrate, for lack of a better term, by itself, and the vast majority of the cytoplasm, and of course all the genetic material is in there. Here, probably this is just the genetic material, but with very, very little else. That completes meiosis 1. And again, when it is ejected at ovulation, it's rested in metaphase 2. It generates and sometimes there's an extra polar body, but it's not a big deal. It generates a second polar body. So here's the first polar body, and then as you can see here, when eventually it's ejected in this form, I didn't mean to misspeak or confuse. In this form, when it is fertilized, and it takes more than one sperm, but that's a whole different lecture. Effectively, it will complete the process, generate typically another polar body, and now you have the zygote. It's there, the fertilized ovum. So, and then they show you the ends, one end and two end, but we're familiar with this. Fetal period, years to complete. Primordial follicles first to develop in the fetus, prophase 1. Only a small number, the vast majority will undergo what they call atresia, which is really just apoptosis. A very significant number. So, I mean, the estimates are like 450,000 total eggs that are there. Each month, we know after puberty, a few are selected for as primary oocytes, and particularly due to the actions of follicle-stimulating hormone, which makes perfect sense. Once this group is selected, one will become dominant, and that'll be the one that will be ovulated. I mean, then there's other things that go along, vis-a-vis twins, whether they're fraternal twins or identical twins, and I'm not going to go into that at this point in time. So this dominant follicle resumes its meiosis just as it's approaching ovulation. So you have the two haploid cells, and basically no cytoplasm, even though genetically identical. First polar body, second polar body, nearly all of the cytoplasm. That's anyway asymmetric. Stops in metaphase 2 and will become ovulated ovum. If not penetrated by the sperm, it deteriorates quickly, and on we go. If penetrated, again, it's a more elaborate process than that, just by saying it, but for the sake of keeping it more simplified, we do this. So again, this is the ovum, the large cell with enough cytoplasm to nourish it for that journey until it undergoes implantation in the uterus. And this one basically deteriorates, showing the same thing you are. So again, typically one viable haploid ovum with 2 to 3 haploid polar bodies are less significant. And I mean, they go into the difference we know about. Spermatogenesis is a much more, you take a look at the numbers that are coming up. The error rates are interesting. It gives you I mean, that's a pretty large error rate, comparatively speaking. I don't really know how that quantifies with regard to what impact that typically has. So it's not really an area that I'm familiar with. So, I mean, I wouldn't ask you to know that, but you get an idea of what happens with the wrong number of chromosomes. Most of those ones that have incorrect chromosomes are typically are not viable. So if you wonder why, I would think, in my way of thinking, a certain number of pregnancies, end spontaneously early on. And I mean, it's not necessarily, I don't know it's necessarily a clear thing, but a lot of it I think has to do with errors that are picked up. And that's my own opinion on it. I can't verify that. I wouldn't presume to speak any more about that than anything else. It's there. Long time to mature. I mean, they use certain things in the pre-antral phase, but in the antral phase, when we begin to see that fluid fill, the FSH and the LH are very, very significant. And they track through all of these things. This is called the zona pellucida, and if I get a chance to do the developmental unit, which talks about the development of the fertilized egg and endoderm, ectoderm, and mesoderm, we will probably look more about that. But again, this is really encapsulates more of a protective area around the oocyte. And so this is classically what you see. Again, you might remember from anatomy, these are where those primary follicles develop and are encased. And by this time, now we're oriented at secondary. And now as it works its way around, it's two-dimensional. So these are centrally placed, the blood vessel. So theoretically, like you can imagine, that's in the middle. So anywhere along that exterior area. And here you can see the ovulation. Here you can see the corpus luteum. And they're showing it to pretty well just this, how easily identified, it's a pretty distinct process that generates that ovulation. I mean, it's not a tiny event that protrudes. it's rather significant, as you will see, just from the size that they described. Okay, so and this is just a transition from different follicles to different follicles. So, I mean, as you can see here, just we begin to see different ways where these can take over. So the connective tissue and granulosa cells in that follicular area, they can secrete hormones in response to luteinizing hormone. So that's where those thecal cells eventually are going to be where the corpus luteum is able to produce estrogen and progesterone. And now here we get the vesicular follicle. The antrum is that cavity where it gets its name. Okay. So the fact that it has that fluid, and we call that the antral phase. Interesting name, continues to expand. The oocyte is surrounded by these granulosa cells, and they actually call that, we use corona radiata a lot. Remember that area in the brain? And thalamus, that band of white matter that basically is the relay system for the thalamus. So if you're coming back, unfortunately, to take, you coming back for anatomy or no? Are you done? Are you doing CVA? You're doing CVA. Yeah, okay. I'll miss you. A little. Pardon me? I'm going to vet school. What's the point of taking me? That's you run into humans all the time. The pets bring their owners in. Can you imagine the dog talking to you and go, here, he's got a problem? You could treat Mr. Ed. You know who Mr. Ed? Talking horse. It was a TV show on Sunday nights everybody watched. Mr. Ed, My Favorite Martian, Ed Sullivan Show, in that order. And then at 9 o'clock, we switched to Bonanza. And 10 o'clock, you flip back to Gunsmoke. It's okay. Okay. So after the oocyte and the corona radiata are ejected, again, those layers, follicle transforms, and they have the corpus luteum. And that's really everything else. Now, we get into the cycles. And this is really the part that you have to be more familiar with, is this. Pardon me for 1 second. So this is the roughly, and you know yourself, everybody's cycles are there. It's because my first wife, it was very difficult to predict because she had polycystic ovarian disease. We know there was going to be problems. Very inconsistent, very difficult. So we assume, the standard, we teach off the 28-day cycle, 2 consecutive phases, ovulation in the mid. And the names are important because they're different. They're 2 different cycles, and the names are there. So as you might guess, the development of the follicle, days 1 to 14, that can vary, maybe by a day or so, where the luteal phase does not. Okay, and that luteal phase is because if in the absence of fertilization, and I always say, and implantation, it doesn't matter if it's fertilized. If it doesn't implant, it's not. It's kind of how the IUD works. It kind of prevents you from implanting these intrauterine devices. And then that number is consistent. Irregular, as you can see. Luteal phase is always 14 days because we know how long the corpus luteum will function. Several antral follicles become sensitive to FSH, and then only one becomes dominant usually. They drop around the middle of the follicular phase. The dominant follicle then outcompetes. So the FSH gets stimulated. There's a subtle drop, follicle stimulating hormone. The dominant one effectively will be the one to outcompete in the sense of undergoing the changes that it's undergoing as it's developing. So it's competing for nutrients and whatever's in the surround. The other ones, again, atresia are undergoing apoptosis. So we know about meiosis one. The granulosa cells then send signals to the other side, causing it to stop meiosis. Okay, I'll buy that. Not too interested in that part. Only you know individually, okay, this idea of what in the German was Mittelschmerz, was this pain that was associated by some, and I emphasize the word some women for ovulation. So that was effectively at sort of signaling ovulation, expelling it into the peritoneal cavity. 1 to 2% of ovulation should release more than one secondary oocyte, which is fertilized, results in fraternal twins, identical twins from fertilization, then separation of the daughter cells. And so I don't have no idea about the numerical aspects of that, but familiarly, and I think I commented on this before, people undergoing IVF have to be so careful because of all the fertility drugs. If you have a family tendency to have multiple births, it accelerates it. So if they're twins or triplets in your line, you're undergoing IVF, you could easily have you could have a basketball team very soon with a sub. So that's and I'm being completely. There was I think I actually never heard of somebody called the Octomom. This lady, she had 8 who are now pretty well grown. I think they're sure at the very least past teenagers. I mean, that 8 at once, that's a lot. My son's commanding officer on the destroyer, that happened to be the destroyer in the Gulf that happened to a hole in some Iranian tanker. Oh boy, Spruance. He and his wife just had quads. You know, I'm sitting there. We were sitting at the same table when my son and his wife were getting married. During the reception, I'm like, "Did you?" I just IVF? No, just 4 on top of one they already had. Oh my! So I mean, it's not always the way. But for instance, that was an appropriate question to ask with my wife at the time. My first wife tried to undergo this unsuccessfully. My aunt and uncle on my dad's side are twins, fraternal twins, obviously, and his dad's dad, so it would be my great grandfather, was one of triplets. So there's a lot of multiple births on my side of the family.
Is there such thing as like family? Like, does it run in the family, or is that just like?
Well, I think it does. Sometimes it just happens, but a lot. If they're in the family, there are. I mean, I think statistically, there's a greater likelihood.
Have you ever heard of like people saying that like you are the generation for that to happen, and is it usually?
Oh, skipping a generation.
Yeah, like it's skipping.
Yeah, I've heard that anecdotally. When you say anecdotally, I don't know if there's proof. It's not something that they've studied scientifically.
Do you think that's usually like on the male side or the female side?
That I don't know.
What causes that?
I don't know. Short answer for both.
What the women can just take on and what will be fertilized, or what the males?
I don't know. I mean, it's interesting. I mean, you could try to look it up. See, is there any, certain tendencies associated with. Well, I'll do a quick look. See, give me something to do when I'm running around, having to get through all the stuff around the house because she's taking care of this stuff. It's okay. I'm good with it. That's my job. For those of you who are not married, you're the only one, I guess, in the class. Husband's job 1, take care of your wife. It's not necessarily reciprocal, but usually it is. In the best marriages, it is. That's job 1. Oh, you don't mind doing that, do you? That's my job description. I signed on for that. So the follicle collapses, okay? The antrum fills, who cares? Corpus hemorrhagic absorbed. This is the big one. Those thecal cells and the granulosa cells, they become the corpus luteum, principally secreting progesterone. Broad brush. Mm. Someone has to. Okay. In general, estrogen is the dominant hormone during the follicular phase. During the luteal phase, it is certainly progesterone. They're both present, but estrogen predominates in the follicular, progesterone dominates in the luteal phase. So, and that's absolutely true. If there's no pregnancy, meaning it isn't implant, it becomes the corpus albicans, turns white, scar, 10 days almost exactly. And then this phase, the last 2 to 3 days of the luteal phase, and the endometrium begins to erode. And we start all over again. Technically speaking, the menstrual cycle starts with menstruation, carries on from there. If pregnancy occurs, the corpus luteum produces hormones sustaining the pregnancy effectively through the first trimester. So it's pretty interesting stuff. I wish I had more interest when my daughter was doing all those egg donations. You know, but I wasn't required to be there. I mean, my daughter's an adult doing this. She can do what she wants. But all those things, I mean, I would have been very, very fascinated to see how things went with regard to that. So this is interesting in and of itself. Before puberty, this is this similar. Remember in the male, that whole idea of GnRH, other than blood clotting and other than the action of the birth canal with oxytocin as examples of positive feedback, we see in female repro the vast majority of positive feedback mechanisms. We start to talk about them here. Before puberty, the ovaries secrete a small amount of estrogen, inhibiting GnRH. At puberty nears, if leptin levels are adequate. Leptin comes from what kind of cells? I have too many of them. What do I have too many cells of? Adipose. That I can take the hit. I know I do. It's all right. My daughter was married in February of last year. I'm about 20 pounds heavier. I gotta eat less and get back more to the gym. So now you're smiling, you're skinny. Moving on. So leptin levels are adequate. Hypothalamus becomes less estrogen sensitive. Okay. So what that means, if there's a sufficient amount of fat, that's why in men, that whole body weight index with percentage of fat, it's fairly forgiving. I mean, you shouldn't go too low, but it's hard to tell people what to do because they want to know what they look like. 5 to 15% in women is necessary for successful reproductive health. And as far as I'm concerned, good health all around. I mean, there's a point of being overly skinny, which is just not good. And only you and your whoever your doctor should be the ones to discuss what's there and what's not, etc. So the hypothalamus becomes less sensitive. Why? Who knows? GnRH is released at that point. So it's all about the leptin levels released by pituitary that acts on ovaries. Events continue, and there's a positive feedback that's involved. This continues just like in the male until we get to a certain point where that adult cyclic pattern is achieved. In other words, more GnRH, and then at that point, the FSH and LH levels, it becomes less sensitive and it continues the sensitivity change until finally it reaches with the adult pattern. So that's more of a positive feedback, and then we have a start. I always tell this part of it, and maybe I told it before, and Jen is not here. And you guys know she's surely a very, very talented figure skater. Okay? If you got your gold medals, that's your teaching credential. She does. My daughter was a good figure skater, not a great figure skater. I mean, she could have been a very good figure skater. She didn't have. She had a silver medal in field moves, which is not one step below the teaching credential, and she had a silver medal, I think, in like doing jumps and stuff like that. Long story short, this is classic with tumbling, with I'm getting there. Gymnastics. God, I was on the tip of my tongue. With gymnastics, okay, with divers, with figure skaters. It's done intentionally. It's terrible. If you didn't remember, it's worth retelling. At where she was training at the time, her coach was coaching another girl who was outstanding. She developed when she was like 12 a double axel. When you have a double axel that early, you're on everybody's radar. She was so much on the radar. She won. There's 5 levels of figure skating that lead up to Olympic level: juvenile, intermediate, novice, juniors, seniors. The lower levels, juvenile, intermediate, don't compete where the figure skaters are all competing if they're trying to win nationals at the different levels and maybe go on to the Olympics. They created what they call the Junior Olympics for skating. She won both. Are you ready? Juvenile and intermediate, because she gets a double axel. Nobody else could. Super skinny from Mars. Super skinny, tiny. And I mean, they had the same coach. They saw each other every morning. They went to every competition together. She was just gifted. I think I told you the story. Here's what happened. So, I mean, the kids came over to her. She had a sleepover at my house. It was a nice summer. We belonged to a swim club, the community pool. Nothing unusual about that. I took my 2 boys and my daughter and the other girl. Shirley's 12-year-old. So maybe you're talking 14, 15, 14 to 12 to the pool. They're hanging out. I'm like, they're busy. I go, well, I'll go over to the snack bar, kids. I'm getting French fries and drinks. And I brought them over, and I said, oh, don't you want any? And I forget her name. And she goes, no, my parents would kill me. I don't know what's going on in that house, but it ain't good. I mean, I think, strictly opinion, my first wife and I thought their parents, they looked at her as a meal ticket. She was going to be famous. She went to the National Training Center out in Colorado. That kind of talent. Never heard from her. We lost track of it, but she never made the big time. When they had the Junior Olympics here at our rink before RMU owned it. It was just called the Neville Island rink or whatever its name was back then. There was a lady from the local sports at that time. The Post Gazette was in the process of folding. It had a big sports team following her around, following her mom around, following her to write a giant article that was going to appear in the paper. And she won. Never heard from her again. And the same thing is for, if you wonder why the Chinese have the best divers in the world, they look at them for body type and flexibility, and they train them to dive, and they train them to be gymnasts, and they control everything, specifically their diet. I mean, there's nothing. Some people it's just wrong. They didn't want her to go into puberty because if she started to be polite, she started to develop. That would make it more difficult for her to accomplish those jumps. So we saw it first, and I'll bet you Jenna could tell you about that type of stuff. I'll bet. I mean, I always thought that was I was taken aback. So we know about that, all of these things, FSH and LH secretions, stimulate the follicles to grow, mature. Eventually, those follicles are going to secrete their own sex hormones that are there. Follicle stimulating, release estrogen, luteinizing hormone, produce androgens, which granulosa converts to estrogens. Again, they're all from that common cholesterol precursor, without going through the arc and all that stuff again. So increasing levels of plasma estrogen levels exert negative feedback inhibition on FSH and LH. Inhibin from the granulosa cells also inhibits that. So only the dominant follicle can withstand this. So that FSH, they're basically impacting the production of these hormones from the pituitary, and only the dominant follicle is able to take. Remember, we talked about that little dip that occurs. This is what explains the dip. And then positive feedback stimulates the gonadotropin release. Estrogen levels continue to rise, and as continue to release by the dominant follicle, those levels reach a critical value, and then positive feedback triggers what's called the luteal surge. That's what creates ovulation, and that's certainly a test question. Luteal surge triggers the ovulation, just about done, and the formation of the corpus luteum. High estrogen levels trigger release of stored luteinizing hormone, some FSH, triggering, and that combination triggers the primary oocyte to complete meiosis 1, be the secondary oocyte, and make its way on to metaphase 2, where it stops. And so there's other things associated. I'll leave it there, and we'll go into all the factors that enable it to do ovulation when we come back on Friday. Hopefully there'll be more than 3 of you.